Gynecomastia is the abnormal development of breast tissue in a man. The other day, I got a concern from a parent who said that their 14-year-old boy was developing breasts which have become quite large as though they were of a girl. The primary problem in gynecomastia is an imbalance in the sex hormones. Women generally produce estrogens, while men produced androgens. The commonest one we refer to is testosterone. And estrogens promote the growth of breast tissue, especially in girls from puberty onwards, while testosterone in men opposes the growth of breast tissue. So if in a male person at some point in their life they have a relative excess estrogen compared to testosterone, then they will end up developing gynecomastia. It should also be noted that the body has got the capability to convert testosterone to estrogen through an enzyme called the aromatase enzyme. And this aromatase enzyme is abundant in body fat. And we'll see how this influences the development of gynecomastia in some men. Now, growth of breast tissue may be abnormal during the growth of a boy child or a man, depending on the stage at which they are. In the neonatal period, we know that children are exposed to their mother's hormones, and so it's not unusual to have babies born with some breast development, but this usually disappears as they grow to their 1 year of age. At puberty also, there are some boys who develop quite some significant amount of breast. This usually is because there is a surge of hormones, especially testosterone at puberty, and it has been thought that the boys who develop breasts around puberty have some intrinsic ability to convert the testosterone to estrogen through the aromatase enzyme that I mentioned. And of course, with the age, generally testosterone levels drop, and quite a number of times body fat also increases among the elderly, and it's not unusual to observe some of the elderly colleagues having some degree of gynecomastia or breast tissue, which most times may not be a big concern or a big worry. However, some of the causes that we may be worried about if we see a young man or a young adult developing breast tissue which is large and unusual for his stage of development is to worry, number one, about tumors. Some tumors in the body, especially those tumors arising from the testes or the adrenal gland, or sometimes some other parts of the body as well, can produce an excess amount of estrogens in the body and lead to an unoccasioned development of breast tissue in an otherwise normal man. Hypogonadism is another reason, and this basically means that the testis fails to produce testosterone. And this can arise from many causes, either from infections or from drugs or medications or from injuries or surgeries to these organs. Certain systemic diseases, for example, patients who have liver disease do manifest sometimes with gynecomastia because there is an impairment of the metabolism of the sex hormones in favor of estrogen production. Drugs, some of them are quite culprit. I have in mind a drug called spironolactone, which we commonly use to treat heart failure patients, and is not unusual for some male patients to complain of gynecomastia, and most of the time we've had to substitute it with a different medication. But last but not least, obesity, which I mentioned, that individuals with a significant amount of body fat will then convert their normal testosterone into estrogen in large amounts, and it's not unusual to see these individuals developing gynecomastia. So if you develop gynecomastia, how should you treat it? Well, the first step is to identify if there's an underlying problem, pathological process. This may take the form of doing hormone tests and doing certain imaging tests. And if the underlying cause is found and treated, then the condition will most likely reverse. For patients who have an excess amount of body fat who are obese, lifestyle measures usually do the trick. You will need to be on either diet or exercise or both. The aim of reducing the amount of body fat or body adiposity, and this has been shown to improve the testosterone levels and therefore lead to regression of the gynecomastia. Like I mentioned, if you are taking an offending medication, then your doctor may need to find a substitute or withdraw that drug altogether if the gynecomastia is causing a significant problem. For those patients who for one reason or another may have developed testicular failure and they are not producing adequate amounts of testosterone, then testosterone replacement is an option. I must caution that testosterone replacement is not for everyone. It's always good to see your doctor so that it can be supervised, so that the patient does not suffer consequences or side effects from inappropriate replacement. And of course, last but not least, if all other mechanisms are not working and the patient is concerned about the gynecomastia and there's no underlying problem that has been found that is causing it, then surgery can also be an option. I thank you very much for your time.